When we think of bone lesions in myeloma, it's important to think of different types of bones. So, for example, the vertebra and the pelvis and the pelvic bones are like a honeycomb. And what happens is the blood and the bone marrow are being produced in that honeycomb of bone, and those vertebrae are stacked upon each other. And so what happens is if the myeloma grows in that area, it can soften those bones and sometimes cause what's called a crush fracture, where the actual bones squash down. And that can cause quite a lot of pain and quite a lot of discomfort. Also, the myeloma protein can sometimes deposit in the long bones, in other words, the bones of the arms or the bones of the legs, and it can cause weakening of the bones and holes in the bones, and it can develop fractures, or sometimes just leak out calcium, or sometimes just cause pain. So what happens with the treatment is that the myeloma protein, the myeloma plasma cells should disappear, and that often will soften the bones, but then the bones should heal. Now, sometimes that can leave a bit of a footprint with that healing process, so the bones may still look a bit abnormal, but they should heal and strengthen up over time. But sometimes what happens is with the crush fractures, that can be permanent, and so it can cause defects on the edge of the bones and a bit of arthritis, and sometimes even when the myeloma has disappeared, there can still be quite a lot of discomfort. There can be quite a lot of discomfort and pain. Some people it completely disappears. In other people it sticks around, and sometimes patients do need chronic Panadine, Panadol, other painkillers, sometimes stronger painkillers, anti-inflammatories, etc. So the bones should improve, but sometimes they don't return completely to normal.